What if your body has been warning you about diabetes and you've been ignoring it every single day? Before any blood test, before any diagnosis, the signs may already be visible right on your feet. And what you're about to learn today could completely change the way you look at your health from this moment forward. Most people believe diabetes can only be detected through a blood test. You visit your doctor, get your lab work done, and wait for the results. That's when you finally find out. And honestly, that's what most people are told. But after years of observing patients, one thing becomes very clear. The body doesn't stay silent. It starts giving warnings long before any report ever confirms anything. And one of the very first places these warning signs appear is your feet. The reason this matters so much is because countless people live with early symptoms for months, sometimes even years, without realizing what their body is trying to tell them. They ignore small changes, assuming it's just age, fatigue, or something temporary. But those small signals often mean something much deeper is happening internally. Let me give you a real-life perspective. Imagine someone living a normal life, feeling generally okay, going about daily routines without concern. Maybe they notice a little numbness in their feet or a slight burning sensation at night. They brush it off. It's nothing, they say, just getting older. But what they don't realize is that these are early warning signs that blood sugar levels may already be affecting their nerves and circulation. This is exactly why awareness is powerful. Because once you understand what to look for, you give yourself a chance to act early, before things become serious. Let's start with one of the most common signs people experience but almost always ignore. That tingling or numb feeling in your feet. The pins and needles sensation. Many people say their foot just fell asleep, maybe from sitting in one position too long. And yes, that does happen occasionally. But when it starts happening regularly, without a clear reason, it becomes something you shouldn't overlook. This sensation can be linked to what's known as nerve involvement. When blood sugar levels stay elevated over time, they can begin to affect the nerves, especially the ones farthest from the heart, like those in your feet. Think of your nerves like electrical wires. When everything is working properly, signals travel smoothly. But when those wires are damaged, the signals become distorted. That distortion is what you feel as tingling or numbness. Another sign that often appears, especially at night, is a burning sensation in the feet. This one can be particularly uncomfortable because it shows up when you're trying to rest. Many people describe it as their feet feeling unusually hot, even when they're not. What's happening here is that the nerves are sending incorrect signals to the brain. There's no external heat, but the brain interprets it as burning. It's like a faulty alarm system going off without a real trigger. And while it may seem harmless at first, it's actually a sign that the nerves are under stress. Now let's talk about something that can become more serious if ignored: slow healing. If you've ever had a small cut, blister, or wound on your foot that took longer than usual to heal, that's something to pay attention to. Normally, the body repairs itself efficiently. But when circulation is affected, the delivery of oxygen and nutrients to the area slows down. Without proper support, healing becomes delayed. Think of it like trying to water a plant with a blocked hose. The water exists, but it's not reaching where it needs to go. In the same way, your body may have everything it needs to heal, but if circulation is compromised, the process slows down significantly. Another visible sign that many people overlook is a change in skin color, especially around the feet and ankles. You might notice darker patches, redness, or even a slight bluish tone. This can be related to reduced blood flow in that area. Your blood carries oxygen and nutrients throughout your body. When that flow is reduced, the skin may begin to reflect it. It's the body's way of signaling that something isn't moving as efficiently as it should. Dry, cracked heels are another common issue people tend to ignore. Most assume it's just dry skin, and sometimes it is. But when cracking becomes persistent and doesn't improve with regular care, it may be linked to changes in how the skin retains moisture. Your body naturally regulates hydration through internal systems. When those systems are affected, especially at the nerve level, the skin can lose its ability to maintain moisture properly. That's why the dryness keeps coming back no matter what you apply externally. Swelling in the feet and ankles is another sign that shouldn't be ignored, especially if it happens regularly. Occasional swelling can happen due to standing or sitting for long periods, but consistent swelling may indicate that the body is struggling to manage fluid balance efficiently. This can be connected to how the body filters and distributes fluids. When that balance is off, fluid tends to accumulate in lower areas like the feet. Then there's foot pain, sharp, stabbing, or electric-like sensations that come and go. Many people assume it's due to aging, joint issues, or past injuries, but sometimes it's actually nerve-related. Instead of becoming numb, some nerves become overactive and send pain signals even when there's no physical injury. Cold feet that don't match the surrounding temperature can also be a sign worth noticing. If your feet feel cold even in warm conditions, it may be related to reduced circulation. Blood carries warmth, so when flow is limited, that warmth doesn't reach the extremities effectively. And finally, one of the quietest signs, something many people never notice, is reduced hair growth on the feet or lower legs. Hair follicles rely on proper blood flow. When circulation decreases over time, these follicles may stop producing hair altogether. Each of these signs on its own may seem small, easy to ignore, easy to explain away, but when you start connecting them, a pattern begins to form. And that pattern is your body trying to communicate. The most important thing you can do is become aware. Take a moment to observe. Pay attention to small changes. Your body is constantly sending signals. You just need to learn how to recognize them. Simple daily habits can make a big difference. Regular movement helps improve circulation. Staying hydrated supports overall body function. Balanced nutrition helps maintain stable internal processes. And most importantly, paying attention to your body gives you the advantage of acting early. Because when you catch something early, you give yourself the best chance to manage it, improve it, and protect your long-term health. Your body speaks quietly at first, but if you ignore it, those whispers can turn into louder signals over time. What if your body has been trying to warn you for months, maybe even years, but the signals were so subtle that you kept brushing them off as something normal? This is exactly how many long-term health conditions begin, not suddenly, but gradually, quietly, and often without pain in the early stages. The human body is incredibly intelligent. It doesn't fail without first attempting to communicate. The challenge is that most people have never been taught how to listen. When it comes to blood sugar imbalance and conditions like diabetes, many people assume that the only way to detect a problem is through a laboratory test. They believe that until a doctor confirms it, everything must be fine. But in reality, the body begins adapting and reacting to rising blood sugar levels long before anything shows up on paper. These early changes are not random. They follow patterns, and one of the most overlooked places these patterns appear is in the feet. Your feet are uniquely positioned in your body. They are the farthest point from your heart, which means they rely heavily on strong circulation and healthy nerve function. Because of this, they often become the first place where small internal imbalances begin to show on the surface. These signs don't usually feel dramatic. In fact, they're often so mild that people dismiss them completely. One of the earliest sensations people notice is a slight tingling or numbness. It may happen while sitting, lying down, or even during normal activity. Most people assume it's just temporary, maybe caused by posture or pressure on a nerve. And sometimes that's true. But when it starts happening frequently, without a clear reason, it becomes something worth paying attention to. This sensation can be linked to how nerves are responding to changes in the internal environment, particularly when blood sugar levels remain elevated over time. Nerves function like communication lines between your brain and body. They carry signals that allow you to feel temperature, pressure, and movement. When these nerves are healthy, signals travel smoothly and accurately. But when they are exposed to ongoing stress, such as excess glucose in the bloodstream, their ability to transmit signals can become disrupted. Instead of clear communication, the signals become distorted. That distortion is what you feel as tingling, numbness, or unusual sensations. At the same time, circulation plays a critical role in how your body functions. Blood is responsible for delivering oxygen and nutrients to every cell. When circulation is strong, tissues receive what they need to repair, grow, and function properly. But when circulation becomes less efficient, especially in the smaller blood vessels that reach the feet, those tissues begin to experience subtle changes. These changes may show up as differences in skin texture, temperature, or healing speed. For example, a small cut or blister that would normally heal quickly might take longer than expected. This is not just a surface issue. It reflects what's happening deeper inside the body. The delivery system is slowing down, and the tissues are not receiving the support they need at the usual rate. Another important factor to consider is how the body manages balance internally. Blood sugar levels are meant to rise and fall in a controlled way throughout the day. This balance is influenced by what you eat, how active you are, how well you sleep, and even how you handle stress. When this balance is disrupted repeatedly, the body begins to adjust in ways that may not be immediately noticeable, but gradually become more apparent. Stress, for example, has a powerful effect on blood sugar and overall health. When you experience stress, your body releases hormones that prepare you for action. This includes increasing your heart rate and raising blood sugar levels to provide quick energy. While this response is helpful in short bursts, constant stress keeps the body in a heightened state, which can affect long-term balance and place additional strain on multiple systems, including the cardiovascular and nervous systems. Hydration is another piece of the puzzle that often gets overlooked. Water plays a key role in maintaining blood volume, supporting circulation, and helping the body process nutrients efficiently. When hydration levels are low, the blood can become more concentrated, which may affect how easily it flows through the vessels. This can contribute to reduced efficiency in delivering oxygen and nutrients where they are needed most. The good news is that the body is highly responsive to positive changes. Even small adjustments in daily habits can begin to support better balance over time. Regular movement, for example, encourages healthy circulation and helps maintain flexibility in blood vessels. It doesn't require intense exercise. Simple, consistent activity can make a meaningful difference. Nutrition also plays a central role. Choosing foods that provide steady energy rather than rapid spikes in blood sugar helps the body maintain a more stable internal environment. Natural, whole foods rich in fiber, vitamins, and minerals support not only blood sugar balance, but overall cellular health. Becoming aware of your body is one of the most powerful steps you can take. Paying attention to how your feet feel, how your skin looks, how your body responds to daily habits. These observations provide valuable information. They allow you to recognize patterns early before they develop into more serious concerns. The key idea here is not fear, but awareness. Your body is constantly communicating with you, offering small signals that reflect what's happening inside. When you begin to notice these signals and respond with supportive habits, you create an opportunity to guide your health in a better direction over time. One of the most overlooked realities about health is that the body rarely moves from normal to disease overnight. It transitions gradually, giving off small, consistent signals along the way. The problem is not that the body stays silent. The problem is that most people have been conditioned to ignore anything that doesn't feel urgent or painful. When it comes to blood sugar imbalance, this pattern is especially common. People wait for a diagnosis instead of recognizing the early shifts happening inside them. As blood sugar levels remain elevated over time, the effects begin to extend beyond just energy levels or metabolism. The impact reaches deep into the nervous system, the circulatory system, and even the skin. These systems are all interconnected, and when one begins to struggle, the others start to reflect that imbalance in subtle ways. Take the sensation of burning in the feet, for example. Many people experience this at night and assume it's due to fatigue, long hours of standing, or even environmental factors. But when this sensation appears consistently, especially without a clear cause, it often points toward changes in nerve signaling. The nerves are no longer transmitting information correctly. Instead of responding to real stimuli, they begin sending false signals to the brain. This creates a feeling that doesn't match reality, like heat without any external source. This kind of miscommunication within the body can be confusing, but it follows a clear pattern. When nerves are exposed to prolonged internal stress, their function becomes less reliable. They may become overactive, underactive, or inconsistent in how they send messages. This is why some people feel intense sensations, while others begin to lose sensation altogether. Both are signs that the system is under pressure. At the same time, circulation continues to play a critical role in how these symptoms develop. Blood vessels are responsible for delivering oxygen, nutrients, and essential compounds throughout the body. When these vessels are healthy, they expand and contract easily, allowing blood to flow smoothly. But when they are affected by long-term imbalances, they can become less flexible and more restricted. This restriction is often most noticeable in areas farthest from the heart, like the feet and lower legs. You might begin to notice that your feet feel colder than usual, even in warm conditions, or you may see changes in skin color, where certain areas appear darker, redder, or slightly bluish. These are not random changes. They are visual cues that circulation is not as efficient as it should be. Another important sign that often gets overlooked is the body's ability to heal. Healing is a complex process that depends on proper circulation, immune function, and cellular repair. When all systems are working together, the body can recover from minor injuries quickly. But when internal balance is disrupted, this process slows down. A small cut or blister that lingers longer than expected is not just a surface issue. It reflects what's happening internally. The body is trying to repair itself, but the resources are not arriving at the necessary speed or in the required amounts. This delay can create a window where the skin remains vulnerable, increasing the risk of further complications. Skin health itself also provides valuable clues. The skin is the body's largest organ, and it often reflects internal conditions. Persistent dryness, cracking, or changes in texture, especially in the feet, can indicate that the body is struggling to maintain proper hydration and balance. This is not always about external moisture. It often involves deeper regulatory systems that control how the skin retains and distributes moisture from within. Fluid balance is another area where subtle changes can become visible. Swelling in the feet and ankles, particularly when it occurs regularly, can suggest that the body is not managing fluids efficiently. This may be influenced by how the body filters and redistributes fluids throughout the day. When this process becomes less effective, fluid tends to collect in lower areas due to gravity. Pain is another signal that can be misunderstood. Not all pain comes from injury. Sometimes it originates from how the nervous system is functioning. Sharp, sudden, or electric-like sensations can occur when nerves begin sending irregular signals. This type of discomfort may come and go without a clear pattern, making it easy to misinterpret. But it is still a message from the body that something needs attention. Even small visual changes, like reduced hair growth on the feet or lower legs, can carry meaning. Hair follicles depend on a steady supply of nutrients and oxygen. When that supply is reduced over time, the follicles may slow down or stop functioning. This is not something most people actively look for, which is why it often goes unnoticed. When you step back and look at all these signals together, a clearer picture begins to form. These are not isolated issues. They are connected responses from a body that is trying to adapt to internal changes. Each signal may seem minor on its own, but together they create a pattern that is difficult to ignore once you understand it. The most important takeaway is not to become alarmed, but to become aware. Awareness gives you the ability to respond early. It allows you to make adjustments in your daily habits that support balance, rather than waiting for more serious symptoms to appear. Simple actions can have a meaningful impact over time. Regular movement helps keep blood circulating efficiently. Staying hydrated supports nearly every function in the body. Balanced nutrition helps maintain stable internal conditions. And paying attention to your body allows you to notice changes before they progress. Health is not something that suddenly appears or disappears. It is something that is built and maintained through consistent daily choices. The body is always communicating, always adapting, always trying to maintain balance. When you learn to recognize its signals and respond with supportive habits, you create an environment where your body can function more efficiently and maintain stability over the long term. In the end, what truly matters is not just knowing these signs, but understanding what they represent. Your body is not working against you. It is constantly trying to protect you, adjust for you, and communicate with you. Every small change, every unusual sensation, every visible difference is a signal, not a coincidence. The problem is never that the body fails to warn you, but that those warnings are often quiet, gradual, and easy to dismiss in a busy life. When you begin to recognize these signals, everything shifts. You move from reacting late to responding early. Instead of waiting for discomfort to turn into damage, you start paying attention to the small patterns that appear day after day. This awareness gives you control. It allows you to make better decisions, not out of fear, but with understanding. The most powerful part of this knowledge is that it puts you in a position to act before things become serious. Many of these early signs are reversible or manageable when addressed in time. Simple lifestyle adjustments like improving your diet, staying active, managing stress, and monitoring your health can create a ripple effect throughout your entire body. These are not extreme changes. They are consistent, practical actions that support your body's natural ability to maintain balance. Ignoring these signs, on the other hand, allows small issues to grow silently. What starts as mild tingling, occasional discomfort, or slight changes in your feet can gradually develop into something much more serious if left unaddressed. That is why awareness is not optional. It is essential. It is the difference between prevention and regret. Take a moment and think about how often you truly check in with your body, not just when something feels wrong, but as part of your daily awareness. Your feet, in particular, can reveal more about your internal health than you might expect. A simple habit of observing, noticing, and responding can make a significant difference over time. You don't need complicated tools or advanced knowledge to begin. You just need attention and consistency. Look at your feet, notice the sensations, observe any changes, and take them seriously. If something doesn't feel right, don't ignore it. Early action is always easier and more effective than delayed reaction. Your health is built in the small moments, the daily choices, the awareness you bring to your body, and the steps you take to support it. When you respect those signals and respond with care, you create a foundation that protects not just your present, but your future as well. Listen to your body before it has to speak louder, because the earlier you act, the stronger your future becomes.